For hundreds of pregnant women across Puerto Rico, a joyful rite of passage is also a scary one.
Siempre pregunto sobre el cerebro.
I always ask about the brain. There's always the worry and unease that everything is okay.
Worry because Zika is giving birth in the middle of an outbreak of Zika virus. In mid-July, Washington declared a public health emergency here as the numbers of Zika cases topped 10,000, including more than 1,000 expectant mothers. In Brazil, Zika has been linked to more than 1,700 cases of microcephaly, a neurological defect causing abnormally small brains in infants. Puerto Rico has seen one diagnosis of microcephaly and one Zika-linked death. Dr. Carmen Zaria is teaching Ganoshka and other expectant parents how to protect themselves from the mosquito-borne virus. The hospital distributes Zika prevention kits, complete with insect repellent, water treatment tablets, and condoms. Protection is crucial because only 1 in 5 people infected with Zika will experience symptoms.
We can have the infection and don't know it, and there's no rapid test. They are prioritizing testing people who have symptoms and pregnant women. So anybody who's not pregnant and doesn't have symptoms might not have a test result soon enough. That means prevention needs to happen without us knowing that we have it.
Dr. Zaria shows her patients a map of where the cases are on the island so they know it's in their backyards.
Patients used to say, well, you know, this is an invention. I don't believe this. I have never met anyone with Zika. Until patients with Zika started showing up.
Zika, she says, bears eerie similarities to what she experienced 30 years ago during the HIV epidemic.
I'm reliving my experiences with HIV. Not that it's the same thing. These are different things. But we're dealing with a viral infection that we do not know the outcomes. We cannot predict which baby will have it and which baby will not. There are no treatments.
Whenever we have a new pathogen that emerges into a large population like the Americas, we need to learn everything that we can about it as quickly as we can. That's what we're trying to do to the best of our ability here in Puerto Rico.
Dr. Tyler Sharp is the lead epidemiologist at the Centers for Disease Control dengue branch here. The center tests every pregnant woman once during the first trimester and a second time during the second trimester.
The virus is going to continue to spread. We are not yet at the peak of the outbreak here in Puerto Rico. Additional people are going to be infected. Additional pregnant women are probably going to be infected. So we need to be doing everything. That's we, as in both CDC, the health department, and the population as a whole. We need to be doing everything that we can to prevent additional pregnant women from being infected.
But Puerto Rico is fighting Zika under siege. The island is mired in debt. It defaulted in July. The government has given the island's health department $3.3 million to respond to Zika. Another $4 million has already gone to education, like these billboards. But just 1 year of a comprehensive mosquito control program is estimated to cost as much as $9 million. Meantime, Puerto Rico's health department budget has been slashed by 25% in 4 years and could run out of a major source of funding by the end of next year. An average of 1 doctor a day already leaves the island.
Having a functional and healthy health system here in Puerto Rico is critical to our response. Physicians and clinicians in the community here in Puerto Rico are critical to everything that we do. They are our eyes and ears.
The debt crisis is evident in so much of Puerto Rico's Zika response. It has also meant fewer workers to collect used tires that make ideal incubators for mosquito larvae.
This is the largest concentration of tires we got in Puerto Rico right now.
There are more than 500,000 tires in this warehouse alone. Each day, government officials say 18,000 more are thrown away.
These used tires wouldn't even be here if the Puerto Rican government had had cash flow. When the government stopped paying to dispose of them, they started piling up, and each one is a breeding ground for mosquitoes.
As Zika cases began to creep over the island, the government sprang back into action. Since December, it's collected more than 1.5 million used tires, relying on tire disposal fees to pick up the tab. Puerto Rico is tropical. Standing water, the mosquito's nursery is nearly impossible to eliminate. The debt crisis has driven more than 200,000 people to move off the island, many abandoning their homes in the process. They leave swimming pools and patios to gather water, with no one watching. Paco San Miguel would like to be watching. He's a professional pest control operator.
These dark places underneath the houses are perfect places for them to breed, to mate.
But in February, Puerto Rico implemented a Zika state of emergency. The decision has sidelined around 2,000 private pest control operators like him.
We have a situation that to be able to seal this, first we need the permission.
They now have to apply for additional government permits to fumigate, and too few are being issued.
I have calls at the beginning of this drama every day. Can we do this at a shopping center that we're serving? No. Can we do this at a pharmaceutical company around the areas of? No.
Paco says he applied for a permit in March, but still doesn't have one.
We were set aside, we're benched right now.
Government officials say they know there are private pest control operators who are willing to join them in the fight.
Would you benefit from having those 2,000 people helping you spray?
Bueno, si estuvieran, claro.
Yes, of course. If they do it adequately, responsibly, and the way it should be, it would be a help for the control of mosquitoes.
With private contractors off the front lines, it's become the island's emergency management agency's job to coordinate Puerto Rico's mosquito control efforts. Agency Director Oscar Sotomayor has overseen building collapse rescues and hurricane preparations, but has never been in charge of a battle against a bug.
Does the Department of Emergency have any mosquito expertise?
We have to learn.
Oscar also acknowledges it is a battle made more difficult because Puerto Ricans fear pesticides. There are regular protests like this one outside government offices. The government limits fumigation in part to protect people from overspraying.
In Puerto Rico, they don't like a lot of sprayhations.
Puerto Ricans don't like a lot of spraying.
No.
So this map you get every week?
Every week, every Friday.
So the department only fumigates where Zika cases have already been identified. There is little to no preventative fumigation. But just west of San Juan, the capital city of Puerto Rico, folks aren't seeing much evidence of any mosquito spraying at all. Have you seen any spraying?
Just here one time.
Despite an island-wide fumigation schedule, we didn't see any spraying either.
During our entire stay here in Puerto Rico, we were unable to film any spraying for mosquitoes. One reason may be weather like this. All this rain, wind, and humidity, experts say, can all limit their ability to do effective spraying for mosquitoes.
You have to take conserve of the weather situation on the island.
Oscar says he's resigned to a long-term fight against Zika, much like other mosquito-borne illnesses which are common here.
Well, I think the Zika stay in the island forever, like dengue, like other diseases, but we have to control them. We have to make our job do it.
But Dr. Zaria wants to completely wipe out the mosquito that carries Zika. She's already charted a doubling of infections among pregnant women in Puerto Rico and fears the future will hold other neurological birth defects, even death, due to Zika.
How many babies with microcephaly do we need to be born to say we need to eliminate this mosquito? 10, 1, 100, 1,000? You tell me the number. We will reach that number.
She is promoting mosquito traps which keep mosquito eggs from hatching and operating her own study of 4 pregnant women, testing them more often than the CDC does for Zika. She knows that with no Zika vaccine and erratic mosquito control, expectant moms like Ganushka face a threat they can't escape.
Realmente es como constante y...
It's a constant worry. It's always there because there are mosquitoes everywhere.